Hi, today is April the 6th, 2022. I want to greet everyone. Again, my name is Yannick Densis. I am advanced practitioner registered nurse based in West Palm Beach, Florida. So the goal of my video is teaching. I want to teach you guys about health promotion and disease prevention. And today's video will be the continuation of the disorder of the brain and nerves, part two. So I always like to start with God words, what God says about healing. If we go to Acts 9, verse 33 and 34, the word of God said, there he found a certain man named Ananias who had been bedridden 8 years and was paralyzed. And Peter said to him, Ananias, Jesus the Christ heals you. Arise and make your bed. Then he arose immediately. So, as we can see, Jesus, God can heal us, okay? So we have to have the faith, I mean, we will get sick, because depending of what kind of lifestyle we used to have, or sometimes it's environmental. So, but at least God will give us hope also. But at the same time, God give you the provider, the medical provider, for whenever something goes wrong, so you can go to consult them, and they are there to help you as well. So today we are going to the teaching will be regarding stroke. Okay, and again, stroke is a part of the disease. Is a part of the disease in the disorder of the brain and nerves. So last time, the video before was we talk about multiple sclerosis, and the next one now today we will be talking about stroke. So what is stroke? So if you see that that brain, on the picture, so if you have a blood clot or a bleeding in any part of your brain, so you will have the stroke. It can be a clot or a bleeding, so that can affect any part of the brain. So, and as a result, we will have those we will have your speech can be impaired, or your visions, or your limbs. So depending which section of your brain who is affected. So what is a stroke? A stroke is the same thing with a CVA, or for long is a cerebrovascular accident. So this is a stroke. The stroke caused by an interruption of the blood supply to any part of the brain. So that the brain we see. So any part of those brain who has clots or bleeding. So that's what we call stroke. This may be caused by bleeding into or around the brain. So if you have the stroke and it caused by bleeding, so that's when we call cerebral hemorrhage. Okay, so if it's caused by bleeding, we call, is bleeding. It's cerebral hemorrhage. A clot which block an already damaged artery, that we call that cerebral thrombosis, or a small clot elsewhere in the bloodstream that eventually causes obstruction in an artery to the brain, and then we can call that, they call that cerebral embolism. So the risk factor for stroke, what are the risk factor to have stroke? The risk factor are smoking, diabetes, diabetic, when you are diabetic, when you have high blood pressure, arteriosclerosis. All those things, they are risk factors for stroke. So the key points to remember, okay, the datas or the key point, I call it the key points to remember, or datas. So the key points to remember is because we are living in the United States. So in the United States, stroke is the third cause of death after heart attack and cancer. So we have heart attack, cancer, and then we have stroke. So it's very prevalent. It's very frequent, and about 1/4 of the neurological patients in nursing homes are stroke victims. So 1/4 of the patients who is reside in nursing home, they are there because of stroke. Because once you have stroke, sometimes, most of the time, you become debilitating. You need somebody to help you. So you need assisted care. So that's why you have to go to nursing home. So somebody, the nurses, the nursing assistant can help you. So that's why it's very important when you have blood pressure, when you have diabetes, you need to take your medication to prevent that. And smoking also, if you can cut down on smoking, this is a big thing that will help you a lot, to prevent stroke. The death rate has declined, but the good thing is, since late 1960s, the death rate has declined by almost 50%. And we can say this, prevention, because now people knows, people now, the scientists, they know exactly what what are the risk factors. So people, they are more careful now. They are trying to do the right thing by smoking less. If you have your blood pressure, you take your medication. Diabetic, you control your diabetic. That can explain why the death rate has declined significantly. Also, stroke victims are generally elderly people with degeneration of blood vessels. So how can people have degeneration of blood vessel? By having diabetics and high blood pressure. So that's why it's very, I'm going to really emphasize about it. I'm very really, I'm going to repeat myself about it. When you have blood pressure, you have diabetics, it's a must. You need to get them under control. You need to get the number under control. Like blood pressure has to be like, 120/60, 120/80, and your blood sugar, like 120, less than 120. That's the goals. Stroke victims are generally elderly people, with generative of blood vessels. All children and young adults also can have stroke, but it's less. But we do find children and young adults who have stroke. More men than women are afflicted by stroke. So men in general, they have stroke more than women. I don't know, it's because they are less compliant with their medication. So that can be one explanation. Also, research shows also that more people of African descent have strokes than any other race. Women using birth control or oral contraceptive are at greater risk of a stroke because the birth control, when women use that, your risk for having blood clots is very high. So that's why us that lead to stroke. What are sign of symptom of stroke? Sign of symptom of stroke is everything like sudden, right? When we say sudden, like if you never have headache, suddenly you have headache, that's a red flag. So the sign of symptom of stroke are what? Confusion, trouble speaking or understanding. Some patient, they have stroke. You are speaking to them, is they look like they are in la la land. They don't understand what you're saying. So depending what part of their brain which is affected, so they're going to have those symptoms. And also sudden numbness or weakness of the face, arm, and legs, especially on one side of the body. So in general, like let's say you have a stroke in left side. Let's say you have a bleeding or a blood clot in one side of your brain. Let's say it's the right side. The side of your body who's going to be affected is the left side. If you have a bleeding or a clot in your left side of your brain, the side is going to be affected is the right. So it's always the opposite side. The opposite side who's going to affect it, depending which side of your brain. So again, if you have a stroke and they do a CAT scan of the brain and the stroke shows that either you have bleeding or a blood clot, it's in your right side, so your left side, is the one who's going to be weak, and affected. And also you can have sudden trouble seeing in one or both eyes. So stroke will affect your eyes. Sudden trouble walking, dizziness, loss of balance or coordination. So depending also the part of your brain who is affected, you will have difficulty with your walking, with your balance. Some people, they cannot walk. They really, depending how severe is the stroke. They can't, their ambulation becomes very impaired. And also any sudden severe headache with no known cause. If you never have headache before and suddenly you have a severe headache, you need to call 911. You need to call 911 to bring you to the nearest emergency room because they need to go and do a CAT scan to see what's wrong. Okay, so with stroke, we have to act fast. The FAST is the key for stroke. We have to act very fast because time is the essence with stroke. And also, if your symptom also goes away, let's say you have, let's say suddenly you cannot see in one eye, or you confused, but the symptom, those symptoms goes away after a few minutes. So that condition, you may have transient ischemic attack. We call that TIA. So even though everything returned to normal, you still need to call your your provider, you still need to see your neurologist, okay? Because when you have TI, even though it wasn't strokes, usually they put you on medication to prevent that happening. And also, please, you need to see a neurologist. So the specialist who's going to treat you is going to do more assessment, evaluations for your stroke. It's a neurologist. So you need to go to see the neurologist and to follow up with that provider. And then, in return, the neurologist will let you know when you can follow solely with your PCP, with your primary care provider. The treatment for stroke. So you need to you need to be you need to be under the care of a neurologist very tightly. You need to follow up because they are going to order some lab work. They are going to order some CT of the brain to see what kind of stroke you have, if it is a bleeding stroke or if it's a thrombotic stroke. So this is very important because according to what kind of stroke you have, the treatment is different. Natural treatment, the naturopath said, they said that rosemary plant, rosemary is a tonic for the circulation. So he said it's good for blood, thin the blood. It's a tonic. So that's why you need to know also what kind of stroke you have, because you cannot take those things. And before you take them, talk to your doctor, work with your neurologist. And they said if you eat fresh leaves or make an infusion with the rosemary. Chinese herbalists use raw berry to regulate the blood. And also there's several studies shows that a regular intake of olive fish and vitamin E guards against stroke. So that will be it for today. Sorry. I thank you for viewing the video, for listening. I will appreciate if you you click like and you subscribe. When you subscribe, press all, so the next video I will upload, you will get the notifications. On that, I wish you the best of health. Bye-bye.